Okay. So, for nursing interventions, NURS 4471, we're going to do a quick video on the neurological assessment. This is going to be a quick 10-minute neurological assessment. So this will not be the full neurological assessment. If you found any abnormalities in the 10-minute neurological assessment, then you would move on to a more thorough neurological assessment, or you would contact a physician, okay? So you may see a little bit different assessment methods used here than you may see in your book, and that's just because we don't need to go as far into detail. As your book will demonstrate, there are different methods to assess each one of these cranial nerves. So you may see something that's a little bit different. Or a little bit more condensed, and there's nothing wrong with that. Now, I'm going to start at the beginning, and we're going to work our way through this. Be aware that I may stop to discuss a couple of different things just to give you some tips and pointers. Do you have anything you want to add to that?
No.
Okay, perfect. All right, so we're going to go ahead and start at the beginning, as if we were seeing our patient in a hospital or clinic setting. Knock, knock, knock. I'm going to sterilize my hands. Hi, my name is Pamela. I'm a nursing student over at Texas A&M University, and I'm going to be conducting an exam on neuro and sensory muscle strength. Can you just verify for me your name and date of birth?
It's Lisa Snell, 8/21/65.
Okay, and if I can look at your badge. Okay, thank you. And can you just let me know, are you allergic to any medication or any other tools, adhesives, anything like that?
Just penicillin.
Just penicillin? Okay, perfect. Okay, I'm going to go ahead and get started. Now, would you like me to ask your visitors to leave, and would you like me to provide you with some privacy?
They can stay.
Okay, perfect.
The privacy is good.
Okay, then we'll go ahead and close your curtains. Okay, so we're going to start with the neurological exam. I'm going to start with cranial nerve 1, which is olfactory. This is your smell. So if I can have you go ahead and close both of your eyes, and I want you to cover one nair, either the right or the left. Okay, and if you can just take a smell and let me know what you smell.
Cinnamon.
Okay, perfect. And if you can release that nair and close the other nair. Okay, again, keep your eyes closed, and if you could take a quick breath.
Coffee.
Perfect. Okay, now we're going to move on to the optic nerve 2, to cranial nerve 2, which is optic, and this can be tested one of two ways, one with a Snellen chart, or with a large Snellen chart or a small Snellen chart. Your large Snellen chart will be posted on a wall, and you will stand 20 feet away. I'm going to use a small Snellen chart. In order to use this, we need to verify that the patient can actually read her letters, numbers, or identify her shapes. If she's not able to do that, then this is not a good option for her, okay? Are you able to read these numbers?
Yes.
Okay, perfect. So if you can hold this in your hand, keep it about 14 inches away, which is about the size of the clipboard in front of your eyes.
Okay.
And if you'll go ahead and start with the large letters and move down to the lowest letters you can see.
Okay. 95874, 2843, 638, 8745, 63925, 428, 365, 374, 258,
Okay.
937, 826, and I can't see that last line.
Okay, perfect.
Okay.
So in order to pass this Snellen test, the patient has to be able to read more than half of the numbers or letters in a line. So if we have 3 numbers in a line, the patient has to be able to read at least 2. If we have 5 numbers in a line, she has to be able to read at least 3. My patient was able to read down to this line here, so that's 2025. 2020 and 2025 are considered normal. Anything beyond that would need further evaluation. Okay. Now we're going to move on to our next cranial nerve, which is ocular motor. Ocular motor, cranial nerve 3, cranial nerve 4, trochlear, and cranial nerve 6 abducens are all tested together. And the way that that is tested is with our ocular 6, with our 6 ocular eye movements. So if you could just look at the tip of my pen and just follow it up, down, diagonal, diagonal, and then to the side. Okay? And I'm going to watch for the eye movements should be smooth. There should be no rapid twitching in the eyes. Otherwise, we need to evaluate for something like nystagmus, which would be done by an ophthalmologist, okay? We're going to move on to cranial nerve 5, which is the transducence. So I'm going to have you go ahead and close your eyes for me. And I'm going to take this cotton swab, and I'm going to touch your face, and just let me know if you feel it.
Mm-hmm. Yes. Yes. Yes.
Okay, perfect. Now, again, we get to skip cranial nerve 6 because we've already done that. We're going to move on to cranial nerve 7, which is our facial nerve. Can I have you smile? Have you frown? Can I have you raise your eyebrows? Okay, perfect. Cranial nerve 8 is our acoustic nerve, and I'm going to be testing her hearing. So if I can have you go ahead and, the best way to do this is stand behind our patient. I'm going to close the tragus in the opposite ear, and I'm going to kind of vibrate it just a little bit to distort any noise, because I want to make sure that she can hear through the ear that I'm whispering in, and I'm going to whisper some letters or numbers to her. Can you repeat that?
A, B, C.
Okay, perfect. Then I'm going to go around to the other side. I'm going to do the same thing. Can you repeat what you hear?
1, 2, 3.
Perfect. All right. So then we're going to move on to 9 and 10, which is our glossopharyngeal and our vagus. This can be tested with a gag reflex. However, we don't want to make our patient vomit while we're in lab, so I'm going to have her go ahead and open her mouth and say, ah, ah. Perfect. And what I'm looking for is I'm looking for the uvula to rise, okay, and the soft palate to rise. Okay, then I'm moving on to cranial nerve 11, which is the spinal nerve. And in order to test this cranial nerve, I'm going to place my hands on her shoulders. I'm going to have her go ahead and shrug her shoulders, and she should be able to shrug her shoulders equally, with equal amount of strength on either side. And I'm going to place my hand against the side of her face. I'm going to ask her to turn against resistance to the right and to the left, okay? Or to the left and to the right on her side. And then we have cranial nerve 12, which is hypoglossal. And for the hypoglossal, I'm just going to have her stick out her tongue. Can you stick out your tongue? Can you move it up and down and side to side? Perfect. That's how we would test cranial nerve 12. Now we're going to move on to her muscles. We're getting into the sensory portion of this exam, and we're going to check for equal strength in all of her muscles, okay? So I'm going to start by asking her to go ahead, and we've already checked shoulders, so I'm going to ask her to go ahead and squeeze my fingers. Show me how strong you are. Perfect. Okay, can you push me away from you? Perfect. Can you pull me towards you? Perfect. And we've checked her upper body muscles. We've checked biceps, we've checked triceps, and we've checked grip strength. Now, if you'll note, I used both hands at the same time so that I could gauge equal strength. It's difficult to do that with one hand at a time, okay? Then I'm going to go ahead and place my hands up against her lower legs. I'm going to ask her, can you push against me? Okay, perfect. Can you pull back? Okay, perfect. Now I've checked quadriceps, and I've checked hamstrings, okay? If there was any concern about her feet, I could ask her to push against pressure and then to lift against pressure. Okay, perfect. So I've checked her strength in all of her muscles. The last muscle that I'm going to check is abductor and adductor. So if I can have you go ahead and open your legs against pressure. Okay, and if I can have you go ahead and close against pressure. Perfect. So my patient's doing a really good job. So I'm going to have her to go ahead and stand up because now I want to evaluate her gait. Okay, so we're going to start by evaluating gait. So if I could have you go ahead and come over here. Now, if I could have you take a few steps towards the wall, okay, with your normal gait. Okay, and then turn around and take a few steps back towards me. Okay, I want to evaluate her gait from the front and the back. Okay, go ahead and stop. Now, if you could turn around back towards the wall. Now, I would like you to do a tandem gait. A tandem gait is a heel-to-toe gait, what some people call a drunk walk.
Okay.
So, so I'm going to evaluate a few steps in that direction. Perfect. Now, you can turn around and walk back towards me.
Same way?
Same way, heel to toe. Okay, and you can stop here. Now I'm going to check for Romberg gait. So with the Romberg gait, I'm going to have you stand perfectly still and close your eyes.
Okay.
And I'm going to place one hand in front of her and one hand behind her to make sure that she does not fall. I'm going to keep her in this position with her eyes closed for 20 seconds. There should be mild swaying, but the patient should not sway or fall or lose balance. Okay, perfect. All right, you can open your eyes and we can go ahead and come back. Okay, so next we're going to test, we're continuing on sensory. We're going to test her her actual sensation, her ability to feel. So I'm going to have her go ahead and close her eyes, okay? And I'm going to test for soft and sharp. So soft, I'm going to use cotton. Sharp, I'm going to use a tongue blade, okay? And I'm going to explain it to her so she understands. So this is soft. This is sharp, okay? So let me know if you feel soft or sharp, and make sure your eyes are closed. So
Soft. Soft. Sharp. Soft. Soft. Sharp.
okay, perfect. And I've checked her upper and her lower extremities for sensation. Now I'm going to go ahead and test for stereognosis. So for stereognosis, I want her to be able to describe for me something that's placed in her hand. So I'm going to have her close her eyes and turn both of her palms upward. And I'm going to place something in your hand and tell me what it is.
It's a safety pin.
Okay.
It's a coin. It feels like a quarter.
Oh, wow, that was specific. Perfect. All right, I would have
Was that right?
Yes, I would have accepted coin. And then we're going to check graphesthesia. So graphesthesia is the ability to tell what is written in your hand. So you should be able to decipher that. So I'm going to write a letter, and I'm going to let her know it's a letter because some letters and numbers can be mistaken. I'm going to write a letter in your hand. Please tell me what it is.
An A.
That's an A. I'm going to write a number in this hand. Please tell me what it is.
Could you do it one more time? A 9.
Perfect. Okay. So now I'm going to check reflexes in upper and lower extremities. And the reflexes we're going to look at are brachial, tricep, brachioradialis, plantar, and Achilles. Okay? Patellar and Achilles, I apologize. Okay, so I'm going to start with the brachial. So in order to do this, I have to make sure that her hand is good and loose and relaxed. I'm going to... Were you able to get it?
Mm-hmm.
Okay, perfect. Okay. Now I always give the arms a
Oh,
little...
sorry.
Okay, I always give the arms a little bit of a wiggle so that they're nice and relaxed and loose before I throw it over my shoulder. Okay? There was a response there. It was not a very great response. We don't need a great response. Just be aware that if you're not able to see it, you will be able to feel the contraction in your hand, okay? All right, there we go. Now I'm going to go ahead and check triceps. So same thing. I'm going to rest her arm. I want her completely relaxed, so I'm going to rest her arm in my hand, kind of give it a little bit of a wiggle, and I'm aiming for the spot, the soft spot right above the elbow. Okay. Did you feel that?
Mm-hmm.
Yeah. So it's just a very small twitch, okay? Sometimes you'll see the pinky twitch, and sometimes you'll see the arm sway. But what you will feel, the actual contraction is in the tricep up here at the top. Okay, did you feel that?
Mm-hmm.
And notice that I'm always tapping my finger, not her arm, because that can elicit pain. Okay, brachioradialis. So for the brachioradialis, we're aiming right alongside of the wrist. So we're going to give the arm, again, a quick wiggle. Did you feel that? Mm-hmm. Okay. And again, the muscle that we're eliciting a response in is your forearm muscle, but you're going to see some movement in the thumb, okay? So you have a very responsive brachioradialis.
Yeah, okay, good.
You're very hyper-reflexive. There we go. Okay? All right. Next is going to be the quadricep. This is the muscle. This is the reflex that you see most frequently done at the doctor's offices. Here we are going to go aim for the soft spot right underneath the patella. Okay? And we're just going to tap, tap. You are hyper-reflexive. So, Professor Snell is very hyper-reflexive. Your patient has to
excel at one thing.
Yes. Your patient has to be completely calm and relaxed. A couple of different things that you can do if your patient isn't able to relax is you can have them grip their hands and pull tight. Or you can have them look up and count the tiles on the ceiling, and that'll take their mind off of their muscles, and that'll make it a little bit easier for you to elicit those reflexes. Next, we're going to do the patellar and then the Achilles, okay? Okay, so for the Achilles reflex, we're going to be aiming for the Achilles tendon. You can sometimes elicit it directly in the back and sometimes on the internal aspect of it. We again want our patient to be very calm and relaxed as much as possible, and we're going to notice what we're looking for is we're looking for a shortening of the gastrocnemius. You may sometimes even see the foot, okay? And here I'm going to hit the patient's Achilles directly, okay? And that was a very small response, but that was a response. I don't know if it was notable, but you could feel it, okay? Now I'm going to go ahead and place her foot down, and I would do the same thing in the opposite foot. Again, make sure she's nice and relaxed. If she can't relax, have her look up and count tiles. Okay, and again, very small response, but we still got a response, okay? So that was our quick cranial nerve and sensory exam. This is what you'll be practicing on one another this week in lab. I hope that this video was helpful, and let us know if you have any further questions. We'll see you next week in lab.
See you next week.